All right, so thank you all for joining us today. As some of you that were on a little bit earlier know that we've had a partnership with the Center for Healthcare Rights for many, many years. And Stephanie has been one of the experts who's been training our Pharm D students with Patrick Tabon to be able to answer the questions for these individual Medicare D consultations that are coming up in November. And that link went out recently, so you should all have that as well. I'd love to introduce to you today Stephanie Fajuri. She is the HICAP program manager and staff attorney over at the Center for Healthcare Rights. And Stephanie, please take it away.
Thanks so much, Jeanette. Okay, so today we're going to talk a little bit about Medicare costs and benefits, some of the background of Medicare and what it covers. What I'm going to do is I'm going to probably move a little quickly through some of the slides so that I can make sure I'm able to leave sufficient time for question and answer. I think that that's the most helpful thing. That's probably why you're here instead of watching a video recording. So forgive me if I go through some things a little bit quickly, but part of that's because I do want to leave time for questions. If you do have questions that come up and you want to put them in the chat, feel free to do so. And then I will likely answer them at the end. Otherwise, at the end, we can have people raise their hands and we'll call on folks. So with that, for those of you who are not familiar with Center for Healthcare Rights, the reason that our agency has had this partnership with USC for so long is because we are the HICAP program for LA County. HICAP stands for Health Insurance Counseling and Advocacy Program. We are funded through the city and county of Los Angeles, but the funding comes from the state of California, California Department of Aging. There are programs like ours in every county in California and in every state under the term SHIP, the State Health Insurance Assistance Program. So I say all of this to let you know that we are a nonprofit. We provide free Medicare and related health insurance counseling and advocacy services to LA County residents. If you are not a resident of LA County and you need assistance, you can always call 1-800-MEDICARE. They do provide some answers to things, and if they can't help you further, they will refer you to your local assistance program, whether that's HICAP here in California, or if you are in another part of the country, assistance is available. When we provide counseling assistance, we typically do this one-on-one over the phone. Some of our volunteer counselors are placed out in the community at various senior centers, but for the most part, our services are conducted over the phone. You do get scheduled for an appointment. Right now, because it's open enrollment, we are scheduling very far in advance, I think 2 or 3 weeks in advance at this point. But I'm delighted to hear that once again, you have access to the pharmacy students to help with your Part D plan finder searches and comparing your options. So hopefully you won't need too much of our help during open enrollment, because I know waiting for an appointment is pretty frustrating. So our phone number is here on the slide. I will share it again at the end. Like I said, I'm happy to try to answer questions at the end of the presentation. But if I can't get to them all, or if you stump me, this doesn't have to be the only opportunity for you to speak with someone who is highly skilled at Medicare. Doesn't have to be me when you call our agency, although I'm always flattered to learn that folks have specifically requested to speak with me. So moving on here, what are we going to talk about today? First, we're going to talk a little bit quickly about Medicare benefits, eligibility, and enrollment periods. We'll talk about Medicare costs for 2023, including, how to talk about, comparing Part D plan options. And then we'll talk a little bit about supplementing Medicare, because I know that that's often a question that comes up for folks that are, potentially planning to retire sometime soon. So Medicare, hopefully everyone here has this baseline knowledge, but if not, we're going to all get on the same page. So what is Medicare? It is a federal health insurance program that provides health benefits to people who are typically 65 or older, or under 65 and have a permanent disability. I will make a lot of references to this red, white, and blue Medicare card throughout the presentation today. So if you've already signed up for Part A or Part B, or if you're already retired, you might have all, both parts. The red, white, and blue Medicare card is something that comes up pretty frequently. And sometimes we talk to folks and they're like, I don't even know if I have Medicare. That's usually our first question. Do you have this red, white, and blue card in your wallet? Eligibility for Medicare is not based on income or resources. It is this is one way that it is different from state, Medicaid programs, or here in California, Medi-Cal. How much income you earn or receive may impact how much you pay for Medicare, but it does not impact whether or not you are eligible to enroll. So we will talk about how income plays a role with Medicare a little bit later. So I'm going to be talking a lot about these various parts of Medicare as we talk about what they're going to cost. So again, I want to make sure we're all on the same page. Part A, which most people get for free. If you're still working, you may have signed up for Part A when you turn 65. Part A covers hospital services. So inpatient hospital services. It also covers home health care, skilled nursing care in a skilled nursing facility, and hospice. Part B, as in boy, covers outpatient services, right? Doctor services, ambulance rides, lab tests, x-rays, durable medical equipment like a wheelchair or a CPAP machine or a continuous glucose monitor, the knee brace, all of those types of equipment. Preventive care. Medicare covers quite a number of cancer screenings and flu shots and other vaccines. Typically, all of those things are covered under Medicare Part B. And then, of course, Medicare Part D, as in drugs. That's always the easiest one to remember. And we'll definitely talk about that today. So who's eligible for Medicare? The basics are that typically folks become eligible at 65. Regardless of whether or not you are already collecting Social Security benefits, whether or not you are actually going to be eligible to receive Social Security benefits, typically folks are become eligible for Medicare at age 65. The only exceptions to that are for folks that have been receiving SSDI, Social Security Disability Insurance, for at least 24 months, so 2 years, so permanent disability, or someone who has ALS or end-stage renal disease. Those are the only 3 circumstances under which someone under the age of 65 can get enrolled into Medicare. So one question we get a lot is, well, I'm over 65, I'm retiring, I'm going on Medicare, but my spouse is under 65. Can my spouse also sign up for Medicare because I'm joining? And the answer is no. Your spouse will have to have other insurance coverage until he or she turns 65. So a lot of times that could be COBRA, that could be an individual plan through Covered California or something like that. But each person's eligibility is based on their own age or whether or not they have a permanent disability. So when does someone sign up for Medicare, or when can someone sign up? So everyone has what's called the initial enrollment period. That's the 7 months surrounding the 65th birthday month. That is often when folks will sign up for Part A coverage and maybe if they are still working, decide whether or not it makes sense for them to continue with their employer group health plan or also sign up for Medicare or switch over to Medicare altogether. So the initial enrollment period, everybody gets it, full 7 months. If you miss your initial enrollment period, you are not necessarily out of luck, but it is important to have a sense, during that period to really understand whether or not it makes sense for you to delay Medicare enrollment, because there can be penalties down the road if you don't follow the rules correctly. Of course, they make the rules super complicated, so it can be challenging to do that sometimes. Now, we are currently in the open enrollment period, which goes from October 15th to December 7th. But when we talk about open enrollment, we are specifically talking about changes to Part D. So this is not the time period where, oh, I never signed up for Part B, I'm going to sign up now. Unless you're eligible for some other special enrollment period or this overlaps with one of these other periods, this open enrollment period is not for signing up for Medicare for the first time. It is for making a change to the way you receive your drug coverage, whether that's switching back and forth between a Medicare Advantage plan and original Medicare or vice versa. You can sign up for a drug plan for the first time during this period, but this is really with respect to Part D changes only. That is why you may be receiving a lot of mail from various plans and seeing lots of commercials from various plans that are advertising heavily during this time period. Any change that's made between October 15th and December 7th becomes effective on January 1st. So we are looking at the next calendar year. If you need to get out of your plan, immediately, you may, there could be issues with that. But if you're trying to make a change, to be effective December 1st, you might be out of luck. Typically, these changes are effective January 1st. Now, every year from January through March, there is also the general enrollment period. The general enrollment period is for signing up for Part A or B if you have missed all of your other enrollment periods. If you don't qualify to enroll at any other time, sometimes I've talked to folks, they retired a long time ago, they've had no health insurance coverage, they, were healthy, didn't want to pay a premium, just decided, I'll sign up for Medicare later, not understanding the repercussions. If they decide to sign up for Part B, down the road, they may need to do that between January and March. And then benefits would start the next month. Previously, there was a delay for benefits to start until July 1st, but thankfully that rule has changed as of this upcoming January. Now, the special enrollment period is something that, if you have some sort of qualifying life event, you may be eligible for a special enrollment period to get into Medicare at a different time. So one of the things that comes up quite frequently for folks that are continuing to work past age 65 is the idea of a special enrollment period to get into Part B, as in boy, without a penalty or any delay in coverage. So we will talk a little bit more about that special enrollment period in a few minutes. So one question for those of you that are still maybe working, or if your spouse is still working and you're covered through the spouse, how does Medicare work with insurance through work? So typically, if someone is covered by an employer health plan from current work and then enrolls in Medicare, the employer plan is typically primary and then Medicare is secondary. Once someone retires or is no longer actively working, Medicare becomes the primary insurance and the retiree plan is secondary. So currently working active work, the employer plan is usually still your primary insurance coverage. And that is a big reason why a lot of folks will delay Medicare enrollment when they're still working, because if they're already contributing to the employer group health plan on a monthly basis, you may not want to pay an additional monthly premium to be enrolled in Medicare for it to be your secondary coverage, which you might not even need to begin with. So let's talk a little bit more in detail about what this looks like. So do I have to apply for Medicare if I'm working and have employer coverage? It depends on the size of your employer. So for you all working for USC, clearly USC has more than 20 employees. So this is the rule that will apply to you. If you are turning 65 or you're already 65 or older and you're currently working, and covered by an employer group health plan from that current work. It could be coverage through your spouse, if your spouse is the one currently working, right? This is all hinging on, is someone still actively currently working and covered by that employer plan? Then you can delay Medicare enrollment until you or your spouse retires without a penalty and without a gap in your coverage. So technically, this means that you have a special enrollment period to get into Part B as in boy. That special enrollment period lasts as long as you're currently working. So let's say you turned 65 October of last year. Your initial enrollment period has come and gone, right? That first 7-month period has come and gone. You're still working. And let's say you want to retire at the end of this calendar year. So you're already over 65. You've already delayed your Part B enrollment. You can sign up for Part B at any time while you're still working and covered by that employer group health plan, and up to 8 months after you stop actively working. So, if you are going to retire at the end of December and you're trying to make a plan to get into Medicare, you may want to start looking into that now, right? Because there are forms that need to be filled out by the employer that indicate that you have had continuous coverage. That can take a little bit of time, but you could do it now and request for those for the Part B to start on January 1st. Technically, you have another 8 months after you stop actively working to get into Part B with no penalty, but most people don't want to have a gap in their health insurance coverage at all. So I always recommend looking into this a month or two ahead of when you know your retirement date will be. And again, this rule applies to employers with 20 or more employees. Every once in a while, we talk to folks who work for much smaller employers. They can't really delay the Part B. They have to get in immediately. Same rules apply for folks under 65 who are becoming eligible for Medicare due to disability. They can also delay that Part B with no penalty for late enrollment, as long as the employer has at least 100 or more employees. Again, USC, that's not a problem. I know that there are more than 100 employees at USC. I feel like I've spoken to more than 100 individually. So now that we have a sense of, delaying Part B, and I'm happy to, touch on that more once at the end if anyone has additional questions about that. But let's talk a little bit about the costs, especially looking forward into next year, because some of these premiums have changed. So most people get Part A coverage for free as long as you have paid into the Social Security system for at least, it's basically 10 years. You have to have 40 work quarters. If you have that work history with Social Security, or your spouse or former spouse, if the marriage lasted at least 10 years, had paid into that system, paid that Medicare payroll tax, you can get Part A coverage for free on a monthly basis. In the past, people were collecting Social Security retirement at age 65. Most folks I talk to these days are delaying hopefully until age 70, if at all possible, so that they can get the maximum benefit. But the reason this says automatic enrollee is because you do technically get automatically enrolled into Medicare Part A if you are already receiving Social Security benefits at that time. For everyone else who is delaying their Social Security benefits, you will have to submit an application to enroll in Part A. And let's say you're past age 65, but you just delayed all of Medicare, you never signed up for Part A. There are no late enrollment penalties if you get it for free, if you have those work credits. And you can, again, if you are currently working, you can sign up for Part A at any time. It'll usually be retroactive up to 6 months. There are certainly some folks that don't qualify for Part A for free if they don't have the work quarters or work credits with Social Security. There is a monthly premium. You don't have to enroll in Medicare if that's your situation. I'm guessing this won't apply to anyone on the call today, but we can talk more about that later. Like I said, most folks do get Part A for free on a monthly basis. Now, Part A is not free when you actually access services. So, this will highlight one of the reasons why it's really important to think about how to supplement your Medicare coverage, whether that's through USC Senior Care or a separate Medigap or going the Medicare Advantage route or Medi-Cal. These costs are, if all you have is that red, white, and blue Medicare card and you show up at the hospital and are admitted, here's what you might expect to pay. There is a first day deductible, which this upcoming year is $1,600. It covers you days 1 through 60 in the hospital and also covers days 1 through 20 in a skilled nursing facility. But let's say, for example, you're admitted to the hospital in January, you go home, and then in July, you're readmitted to the hospital. You go home at the end of July. Let's say you're then readmitted to the hospital in, I don't know, December, right? This is not an annual deductible. This is per benefit period. And a benefit period starts the day someone's admitted to the hospital and ends once they have not been hospitalized for 60 days. So for some of our clients, they might be in and out of the hospital all year round. And if there has been more than 60 days since their last hospitalization, without additional coverage, they could face yet another first day deductible. So in that situation I just presented, 3 different separate hospitalizations far apart in the same calendar year, that could be 3 first day deductibles. That adds up. Again, another reason why it's important to have some sort of secondary coverage. Now, Medicare Part B as in boy, not free on a monthly basis, not free to access services. Nothing about it is free. Preventive care, once you're paying for Part B, most of the preventive services are free, but obviously you're paying to be enrolled. So the 2023 Medicare Part B premium, the standard monthly premium is $164.90. So that's a little bit lower than this year. This year it's $170.10. It did go down a bit, which is somewhat unusual. But there's a couple things to keep in mind about Part B and these premiums. So the first thing is that I've mentioned now a couple times that there can be late enrollment penalties. This is why it's really important to keep in mind whether or not it's appropriate for you to delay your Part B coverage. So I want to give you a little bit of a horror story that hopefully will scare you enough. Happy Halloween in advance, scare you away from using COBRA. If you become eligible for COBRA, let's say you're being laid off or offered early retirement, if you are already 65 and, eligible for Medicare, COBRA is a terrible idea. I had a client who was laid off at the end of 2020. I'm sorry, end of March of 2020 because of the pandemic. He was already 65 at the time, was told that his employer was offering him COBRA as part of his severance package, and that they would also pay the monthly premiums for COBRA, which sounds like a nice deal because COBRA can be very expensive. Unfortunately, he got bad information from an insurance broker who he was friends with, who said, oh, sure, you can take COBRA. And then once COBRA is done at the end of 18 months, then you can sign up for Part B. That is not correct because, as we mentioned, you only get that Part B special enrollment period for the entire time that you are still actively working and covered by, again, actively working and covered by the employer plan, and up to 8 months after. So when he called us month 18 of his COBRA, he was already 10 months away from his special enrollment period and should have had Part B coverage that whole time. So not only did he face a late enrollment penalty, he also had to wait to sign up for Part B during the general enrollment period and had a huge gap in his coverage. So these are lifetime penalties. It is 10% of the monthly premium for every 12-month period. You should have had Part B, but didn't. So 10% is nearly $16.50 per month that could get added on for life. that client ended up with a 20% late enrollment penalty. This is just something you want to avoid. So any questions about delaying Part B coverage, definitely let us know. The other thing I want to clarify is that the standard monthly premium of $164.90 is for people who earn under a certain threshold. So for this upcoming year, that threshold is $97,000 for an individual, $194,000 for a married couple. If you earn more than this, or actually if your adjusted gross income from 2 years ago is more than this, you will face what's called the income related monthly adjustment amount, or IRMA. So I have more detail about that here. So for example, if you are trying to decide whether or not it makes sense for you to sign up for Part B now while you still have the employer coverage through USC, or you're trying to figure out what your costs are going to be for Medicare down the road. Again, they always look at your tax return from 2 years prior. So they're looking at the 2021 tax return. Let's say you are single and your adjusted gross income in 2021 on your tax return was $125,000. So that would put you in this bracket here. So that means that your monthly premium for Part B would be $329.70. Let's say you're married and your combined, you filed together and your adjusted gross income from 2 years ago was $415,000, right? That puts you in this bracket. Then per person, if you are both Medicare eligible, you would per person pay $527.50 for your Part B coverage. That's just for Part B, right? Part A might be free. Part B, you might be paying this amount. That doesn't include drug coverage, supplemental coverage, etc. So this is another reason why a lot of folks will delay the Part B enrollment while they're still working, because your income's obviously going to be higher. Well, for most people, is going to be higher while you're working than once you retire. So paying that additional premium for secondary coverage doesn't typically make a whole lot of sense. And my understanding is that, for folks on the USC PPO plan, they may be contributing less to those monthly premiums than, what they might end up paying for Part B, D, etc. But that might depend on your own situation and obviously what your income is. So the way that this works, like I said, it's a 2-year look back period. Social Security gets this information from the IRS. They share information that Social Security sends out the letter to you, letting you know this is how much your monthly premium is going to be for Part B, including your IRMA. Assuming you get one. If you're under that threshold, then you won't get this letter. But the letter will also tell you how you can appeal. It's not a done deal. You can potentially appeal, especially if you've had a change in circumstances or a change in your income. So for example, if you were earning a whole lot more money in 2021, and once you file your 2022 tax return, that shows that in 2022, your income had gone down substantially, you can ask Social Security to reevaluate you based on the more recent tax return. Or if you are retiring, my understanding is that you can also submit a letter from your employer documenting that you are retiring and having a loss of income. Another, couple of examples are if you get divorced, if your spouse dies, right? If your combined household income goes down substantially for one reason or another, you can potentially request that they review your information again and adjust your IRMA accordingly. So this is what the form looks like. It's SSA 44. But the letter that you get from Social Security about the IRMA will tell you how to go about appealing. And then again, every year they are getting updated information. So it's not like you're locked in forever at one amount. I know that sometimes there are years where, oh, you sold property or sold, investments or whatever, and you get sort of a windfall, and that might mean that you might be paying higher premiums that one year. So just keep that in mind. Okay, so Part B, I'm going to try to keep moving along here. Part B, not free when you go to the doctor either. If you only have that red, white, and blue Medicare card, there is a $226 annual deductible this upcoming year. That went down by like $7 from this year. So, at least it didn't go up. And then if you don't have secondary coverage, you're familiar with the idea that Medicare covers 80% of your costs. The beneficiary is responsible for 20%. The problem is 20% of what, right? Oh, you need an MRI. Well, great. How do you have any idea of what you're going to be charged for that MRI? Nobody knows what the Medicare approved charge is for that particular test. The doctor's office should know, but it just makes it very difficult to plan ahead or to budget. So again, a helpful reminder that it's typically a very good idea to have some sort of secondary coverage. Now, do you have to enroll in a drug plan? Part D, right? We're talking about Part D a little bit more today because we are in the open enrollment period. If you have other drug coverage, like, for example, employer group coverage through USC, I know there's the USC PPO. My understanding is that plan does provide what's called creditable drug coverage. Creditable drug coverage means that it is just as good or better than the standard Medicare drug benefit. For as long as you have that creditable drug coverage, you can delay Part D. So for someone who's 65 or older, continuing to work, covered by the USC PPO plan, you can delay your enrollment into Medicare until you retire, right? Until you stop actively working. That includes drug coverage. Now, we're going to talk about the timeline for signing up for Part D once you do plan to retire. But one thing to keep in mind is that if you wait too long, sometimes I talk to folks and they're like, I don't take prescriptions. I'm very healthy. I don't want to pay for a drug plan until I really need it. Well, that certainly is your prerogative. And there are some folks I've talked to who they're just adamant. They will never sign up for a drug plan. They'll pay out of pocket. They'll get coupons, whatever. But there are penalties for late enrollment for Part D as well. So that's something to keep in mind. So the penalties, it says national base premium. That means that the average cost of a Part D drug plan through Medicare is about $31. So that means that your penalty would basically be like 33 cents or 31 cents for every month that you go without drug coverage, but should have. So that's basically $4 a year as a penalty. So then that would be $4 that get added on to your monthly premium for the rest of your life. Again, I like to help people avoid penalties when possible. So when we're talking about drug plan choices, there are two options. The first option is a prescription drug plan that just covers your prescriptions, Part D. Part D prescription drug plan, you continue to use that original Medicare, your red, white, and blue Medicare card for your A and B services. The plan premiums vary from plan to plan. Some of them are like maybe $7 or $8 all the way up to like $170 per month. If you want to help, if you need help comparing your options, I know the USC pharmacy students do offer that service. Our agency does also help with this, but you're probably better off with the USC pharmacy students at this point, just because of the delay to get an appointment with us for this current open enrollment period. So one option, original Medicare with a prescription drug plan. The other option, and this is probably what you have seen numerous TV commercials for and gotten probably tons of mail about, Medicare Advantage. So Medicare Advantage is also referred to as Part C. I don't use that term because I think it implies that it's a mandatory part of Medicare when it really is an option. For some people, it's great. For some people, it makes a lot of sense. Some people love their Medicare Advantage plans. Some people would rather be caught dead enrolled in a managed care plan. So Medicare coverage for drug coverage, not a one size fits all situation. Our agency does not sell insurance. We are neutral. We are required to be neutral and unbiased. So, I can't tell you, does Kaiser make more, is Kaiser the best option for you? That's really going to depend on your situation. Is SCAN the best plan for you? Again, going to depend on your situation. Sometimes I talk to folks, they're like, well, my neighbor has this plan, so I think I should sign up for it. Well, the neighbor's medical condition and prescriptions and doctors and needs might be very different from yours. So again, not a one size fits all situation. Typically the Medicare Advantage plans are HMOs. There are a few PPOs, but most of them are HMOs, which means you have to go to a primary care doctor to get referrals to specialists. There are medical groups that are potentially approving, prior authorizations and stuff like that. Specific doctors and hospitals you have to go to. All of that sounds maybe somewhat negative, but the out-of-pocket costs when you have a Medicare Advantage plan are typically significantly lower. And many of these plans offer additional benefits that are not covered by Medicare. We'll talk a little bit more about that in a minute, but one thing to note, if you are above that high earner threshold that we talked about for IRMA for Part B, there is also an IRMA for Part D. So you will get that notification in the mail as well. Now, for my visual learners, here is another representation of what I just mentioned. When we're talking about Part D coverage options, you have either original Medicare with a prescription drug plan or a Medicare Advantage plan where you have assigned your Medicare benefits to a private insurance company that gets paid by Medicare on a monthly basis to provide you with Medicare coverage. So it's one or the other. Oops. So when can you make changes or sign up for Part D? Well, obviously the initial enrollment period, right? That's when everybody has the opportunity to sign up for the first time. We've also talked about the open enrollment period already that we are in the middle of. Changes become effective January 1st. There is also the Medicare Advantage open enrollment period. If you decide to go that Medicare Advantage route and you sign up for a plan through Blue Shield or, an HMO through SCAN or whatever, if you realize in sometime between January and the end of March that you don't like your plan, or you made a mistake, or someone fraudulently enrolled you into a plan that you didn't want to sign up for, there is this Medicare Advantage open enrollment period where you can potentially change your coverage back or pick a new plan. But that's only for folks that have started the year on January 1st enrolled in a Medicare Advantage plan. Now, one thing I do want to flag is that the best way to make a change to your drug coverage through Medicare is to pick a new plan and just sign up for it. That will automatically cancel out your previous enrollment. I have unfortunately spoken with too many folks who are basically somewhat misled by their plan, learning that, oh, well, I want to get out of my current plan, so I need to submit all of this disenrollment documentation to them, and then I can go and pick a new plan. No, do not bother with disenrollment paperwork, because what can happen sometimes is Medicare will see that and they'll say, oh, Stephanie made her one choice for this open enrollment period. That one choice was to disenroll from drug coverage. And then if I turn around and say, but my one choice was really that I wanted to get into this plan, they'll say, nope, sorry, you already made your one election, and your election was to drop that coverage. So that you don't get into that situation, the best way, and I'm sure that this is how, the USC pharmacy students handle it, you just pick the new plan, enroll in the new plan, and it will automatically cancel out the coverage that you had before, if it's a Medicare plan. Now, there are other situations where you can sign up for drug coverage outside of those other enrollment periods. So, we talked before about if someone's still working, delaying the drug coverage. Once someone retires, you have stop actively working, you no longer have employer-based drug coverage, you have then a special enrollment period to pick a drug plan or Medicare Advantage plan. When I say drug plan, I mean standalone drug plan or Medicare Advantage. But these special enrollment periods are typically only 63 days. So you might have 8 months after you stop actively working to get into Part B, as in boy, but you only have 2 months to get into a drug plan. So, the timing sometimes doesn't quite work the way we want it to, but just keep that in mind. Typically, it's a 2-month special enrollment period to get into a drug plan. If you live in LA County now and you're like, I'm going to, move to Riverside County, I want to live in Palm Springs and move into the desert, that would potentially open up a special enrollment period because you might be moving out of your plan service area. And then entering or leaving a nursing home, also a common scenario. So the drug coverage under Part D, the annual deductible for this upcoming year is $505. So the deductible is how much you pay out of your pocket before the drug plan kicks in. Some of those Medicare Advantage plans waive the drug plan deductible. And I think some of the Part D plans may have a reduced deductible, but you might end up making up for it with copays. I mean, the plans have a little bit of flexibility for how they want to handle this, but many of the drug plans do have this $505 deductible. And then essentially you are paying 25% of the total retail cost of the prescriptions, whether it's brand name or generic, until you reach out-of-pocket costs of $7,400, which is when you reach the catastrophic coverage phase, where you're paying 5% of the cost of your prescriptions. So, hopefully you won't get there. There are some clients I talk to who do not get to the catastrophic coverage phase ever in their lives. Some folks take very expensive prescriptions and are in the catastrophic coverage phase every year. So do keep that in mind, that it is typically a 5% copay once you get to that phase. But for the rest of the time that you have Part D coverage, you're typically paying 25% of the total retail cost. So how to select a drug plan. So there's a couple of different things to keep in mind. And if you do end up working with the USC pharmacy students, I'm sure that they will talk to you about these things as well. But, when we're talking about Medicare Advantage plans, because they are mostly HMOs, right? They have a specific, but even the PPOs, right? They have a specific plan network. There are specific hospitals that will accept those plans. The first thing I always tell folks, if they are thinking about either selecting a Medicare Advantage plan for the first time or switching Medicare Advantage plans, if you have a specific hospital or specific doctors that you want to continue to work with, check with them first, because not every doctor takes every single Medicare Advantage plan. Usually they'll take maybe 4 or 5 different ones, right? So for example, and I hate using UCLA as an example here, but I'm going to do it. So, last year we got a lot of calls from folks who said, I've been going to UCLA Medical Center for a very long time. I have SCAN as my Medicare Advantage plan. But I got a notification from UCLA that they are no longer accepting SCAN as of January 1st. Now what? So because we knew that they wanted to keep going to that particular medical center, we could look on the website, see, okay, they're no longer going to accept SCAN, but they are now going to be accepting whatever, AARP United Healthcare or whatever plan it was. So that really helps narrow down the options. In LA County, we have 80 plus Medicare Advantage plan options. And so if there's not a good way to narrow down those choices, you can get lost pretty quickly. So typically the first thing I say for Medicare Advantage, check with the hospital you want to be able to go to, check with the doctors that you want to be able to continue to see, and that will be the first way to narrow those options down. Now, Medicare does have a plan finder search tool on its website, medicare.gov. That is what we use to compare drug plan options and Medicare Advantage options. That is also what the USC pharmacy students will use. It is a very, I won't say it's super user-friendly, but it is the best tool that we have to compare one plan to another and compare costs. So the way it typically works is that you will enter in the zip code where you live, because, you know, the options may be different, especially for Medicare Advantage. A lot of those are based on the county you live in, as opposed to the state, which is the drug plans are typically statewide. But you enter in your zip code, you enter in your prescriptions, including the dosage, also the pharmacies you want to be able to go to. If you have a preferred pharmacy, that's one way to sort of narrow things down too. I've had clients that they swear they will only go to Capital Drugs in West Hollywood, or, you know, whatever their local pharmacy is. So, and then the results that populate are based on the lowest cost, right? So that's how you can compare the copays, the monthly premiums. So this search tool on the Medicare.gov website, it's the first thing that comes up when you go to Medicare.gov right now. I know that's what we use, and that's what the USC pharmacy students use. So you can also set up an online account on Medicare.gov and actually save your prescription list. That can make it easier for you to run these search results each year, especially for some medications, you know, you might be taking for a number of years. So once you get it set up initially, that can make it easier down the road. You know, one question I get a lot is, do I have to change my plan every year? No, you don't have to, but I do recommend comparing the options, because, you know, before some of you might have logged in, Jeanette was saying that some of the USC pharmacy or the USC pharma students had saved some USC, you know, faculty or former faculty and staff thousands of dollars by switching their plan. So another example, last year we got a lot of calls from folks that were on one specific drug plan. And the monthly premiums for that plan were going up from $30-something per month up to $90-something per month, just for the monthly premium. That doesn't even account for any of the copay changes. So if people had remained on that same plan, they would have been paying an additional $60-something per month for the whole year for coverage that was no better than what they had already, you know, been receiving. It's not like all of a sudden they were getting extra benefits. So, you know, all of those folks that we talked to ended up switching their drug plan because there was another option available that covered their prescriptions at a lower cost. So this is one of the reasons why it can be really, really helpful to compare your options. Maybe the result will be that you are on the best plan for you, but it's always good to confirm that. So I'm just going to go really quickly through the next several slides. I do want to leave time for questions. So just as let me see there, if you have very low income and are struggling to pay for prescription drugs, you may qualify for a program called Extra Help. But I'm not going to go into detail about that today. You know, talking about other ways to supplement your Medicare coverage, because there are all these out-of-pocket costs, and you want to probably limit those, right? Plus there's other benefits that are not covered by Medicare, like dental, vision, hearing aids, etc. I'm just gonna sort of stick on this slide here for a second. So we talked about having original Medicare with a separate drug plan, but this model has lots of out-of-pocket costs, right? We talked about the first day deductible in the hospital and the 20% coinsurance if you go and get doctor services. That's a lot of money. So typically the folks I talk to who go this route, they prefer to have more flexibility about doctors and hospitals. They have to have secondary coverage. For folks with very low income, they might get Medi-Cal. For folks that, are USC faculty or staff, one of those options is USC Senior Care. I believe it's $250 a month. And I think it includes dental and vision, but I am not an expert when it comes to USC Senior Care. There are lots of excellent resources within USC to talk to you more about senior care. But I know that some folks that I've talked to have been contemplating, do I want USC Senior Care or do I want to get a Medigap, right? A Medigap is an insurance policy. It's not health insurance. But both of these plans operate as secondary coverage. They pay the co-pays when you go to the doctor's office, but the differences might be, for some people, it might make a lot more sense to do USC Senior Care. For other folks that maybe don't plan to continue getting all of their care through the USC, providers, maybe it might not, or if they're planning to move out of state or something like that, having a Medigap might make more sense. But again, it's going to be a personal decision about how you want to get your care and what types of providers you're looking to go to. Medicare Advantage, we've talked about already. There can be additional benefits. Some of them do include dental and vision, but then you have way fewer out-of-pocket costs on a monthly basis because you're typically not paying anything additional for the drug coverage. You're not paying for an additional supplemental plan. But the downside for some folks is that you are then limited to a specific network of hospitals and doctors and may have difficulty getting access to care outside of that network. So the last thing I'm just going to mention, I'm not going to talk about Medi-Cal, but I do want to just flag really quickly that Medicare marketing violations are really rampant, especially this time of year. So just sort of 2 words to the wise: always protect your Medicare card number. Do not give it out to someone you do not trust. Medicare is never going to call you. No one should ever call you or knock on your door saying that they are representing Medicare. And if you do run into a situation where you feel like you have been misled by an agent or broker to join a plan that you either don't want or doesn't meet your needs, you can always reach out to our program and we can provide assistance and report, potential fraud violations to Senior Medicare Patrol. So with that, I know I went a little bit longer than I wanted to, but I do see that there's a couple questions here that have been asked as a direct message. So I know the rest of you can't see them. I will read them out loud. I will not read your names. But if anyone else has questions, feel free to start typing them in. So I see one question here. Is that a dollar limit on PT? Is there a dollar limit on PT for this year? So I believe there used to be some sort of limit on physical therapy. Technically, there is not supposed to be a limit. There was a lawsuit called Jimmo v. Sebelius, where the result was that folks were not supposed to be terminated from skilled care like physical therapy because they had reached some sort of plateau. We know that a lot of folks, if they might reach a plateau, but if they stop PT, then they're going to regress, right? Lose muscle mass, lose whatever. So technically, the Jimmo v. Sebelius lawsuit indicates that providers are not supposed to terminate those services just because there has been a plateau, I know that the dollar limit thing was like, you might need to get additional approval to go beyond a certain amount of physical therapy. In practice, we still see providers, terminating care probably prematurely. And there's not, I hate saying this, there's not really a great way for us to enforce some of those rules. But if you run into a situation like that, feel free to give us a call and we can try to, see what else we can do. The next question was, is there now an out-of-pocket cap for Part D? Not yet. So the Inflation Reduction Act did make some changes to Part D, but they are not going into effect. They're not all going into effect now. The biggest change for Part D for this upcoming calendar year is that if you use insulin, the monthly insulin copay cap is $35. But the out-of-pocket cap for Part D, that does not go into effect, I think, until next, it's either 2024 or 2025. Some of this is being, sort of drawn out here. And then the third question here, when will Medicare start negotiating for drugs and which drugs will be part of this program? Great question. That's also related to the Inflation Reduction Act. It's not happening this upcoming year. I think there's something about if the cost of the drug has gone up more than the amount of inflation, that some Medicare Part D beneficiaries may be entitled to some type of reimbursement for the difference. That might be going into effect somewhat soon, but I think the negotiation is going to be limited to it's not going to be every medication as far as I know, but some of this stuff, to be honest, I'm still sort of wrapping my head around. But I know that negotiating the drug prices is not going to be a factor for this upcoming calendar year, as far as I know. So thank you for those questions. That's reminding me that I need to do a little bit more investigating into and review of the Inflation Reduction Act. Okay, so next question. Should my over 65 spouse, while I am working, sign up for Medicare A and B? So there's typically no harm to sign up for Part A, because Part A is free, and if your spouse is covered through your active employment, the spouse might not really need to have either of those two parts, A or B. I do tend to find, when I've spoken with clients, they have an easier time getting the paperwork filled out for Part B later if they already have Part A, because once you sign up for Part A, that's when you get assigned that Medicare card number. And then the forms to sign up for Part B later will often ask, for the Medicare number. That doesn't mean it's impossible to sign up for Part B later without already having Part A. Certainly your spouse could wait until you retire as well, or, you could do it at the same time when you know that you're going to retire. But I tend to say, there's no harm in signing up for Part A. The spouse could potentially wait on Part B as long as he or she is covered by your employer group health plan. Okay, so next question here. Someone with such a huge income ought to be saving for Medicare costs. Why should they get to pay the minimum rather than the cost for those with grossly high income? So yeah, so someone who has very, very high income will be paying much more on a monthly basis for their Medicare based on those IRMA sort of brackets that I showed you. Yeah, presumably folks should be saving for medical costs as well. But yes, typically the folks that are paying, that have much higher incomes, that is part of why they're, assessed the IRMA to pay those higher premiums. Someone asked, I have a question about my recent dental coverage costs. So, dental is something that I don't have a lot of things to say. Medicare does not cover dental. Some of the Medicare Advantage plans do, to a limited extent. For folks that have original Medicare and are looking for dental coverage, you can typically sign up for a dental plan at any time. You could call Delta Dental or MetLife or Principal or whoever you want to have your dental, coverage through. There's no open enrollment period for dental. It's pretty straightforward to sign up. Whether or not the dental plans that you're looking at actually cover what you want them to cover is a whole nother story. I mean, I've talked to some people who really believe dental insurance is a scam altogether. A lot of my clients have opted to simply pay out of pocket for dental services when they go get them, because then you can get sometimes like a cash discount. But I might not have much more to say about dental coverage than that because our agency does not really do much with respect to dental. Okay. Next question here. If we enroll in a Medicare Advantage plan, can we revert back to Part A, B, D with USC Senior Care during the enrollment period? I believe the answer is yes. My understanding is that you can sign up for USC Senior Care at any time. The question will be whether, you may have to wait until an enrollment period to get the Part D coverage to switch out of the Medicare Advantage plan. But my understanding is that if you do that, you should then be able to work with USC to get into the USC Senior Care. And Jeanette, feel free to correct me if I'm wrong, but you're nodding your head, so I think
That's
I'm on the right
correct.
track.
That's correct.
Okay. Great. At some point, I'll be able to incorporate more about USC Senior Care in these presentations, but I don't want to put anyone else out of a job. Okay, next question here. I'm covered under my spouse's plan. He is now retired, but I continue to work. Do I have to sign up for Part B now, or can I wait until I retire? So if your spouse is no longer actively working and you are covered through your spouse's plan, you likely will need to sign up for Part B. You may want to confirm that with your spouse's employer group health plan, but typically when you're no longer covered through active work or current work, even if you are continuing to work, you might be able to get on the USC PPO. But if you're covered through your spouse's plan and he is retired, most likely Medicare would become your primary insurance and the retiree plan would be secondary. Some plans always, they'll confuse me. I've talked to folks who worked for a really small employer who said, oh, I already confirmed my employer said they'll continue to pay primary to Medicare. That doesn't make sense to me in terms of how the rules are supposed to work, but I have been surprised by some of these plans. So I would double check with your current insurance coverage, but you may need to sign up for Part B within 8 months of when your husband stops working, if that's who you're covered through. Okay, another question here. You may want to clarify that on Part D plans, many routine generic drugs have no deductibles, even if the plan has a higher deductible for higher tier drugs. So yes, that is a really good point. There have been many times where I have run a drug plan search and someone has taken a really common generic drug, like atorvastatin is the generic for Lipitor. We talk to a lot of clients that are on that medication, and some of the drug plans have a $0 copay for some of those really low cost common generic drugs. So there have been clients I've spoken to who the only medication they take is really an inexpensive generic medications. They might never even need to meet that deductible to fill those prescriptions because the copays are so low, or they are sort of exempt from the deductible. So thank you for sharing that. I do think that's a good point. Do any Advantage programs cover USC CHICAP doctors? I'm sure that there are USC CHICAP doctors that accept Medicare Advantage plans. I don't know which ones those are. You would have to speak with those doctor's offices directly, or maybe check the USC CHICAP website. Some of the hospitals will give a list of the prescription or the Medicare Advantage plans they accept. Some of them say, call us for more information because it might change from year to year. But yeah, I assume that there are some Medicare Advantage plans you could enroll in and continue to go to at least some USC CHICAP doctors, but they might not all accept the same plans. I don't, it really varies from hospital to hospital how that works. Okay, next question. I have Medicare A, B, D, and senior care. When I had my shingle vaccine at CVS, I had to pay a $45 copayment. I thought it was covered. So I think I can never remember. There's like 2 vaccines that are covered under Part B, and then there's the rest are covered under Part D. So it's possible. I mean, you're not the first person I've talked to who's run into issues getting a vaccine at CVS. Sometimes they do not bill correctly. So you may want to double check if you have, I mean, if it's the part, I'm sorry, I can't remember whether the shingles vaccine is covered under Part B or Part D, but if it's a Part B drug, then potentially you would have a copayment if you're outside of the USC network. I don't know how senior care works with CVS specifically. If it's a Part D vaccine, D as in David, those can have a copay. I believe that is changing next year. That is one of the other changes happening with Part D, I think, under the Inflation Reduction Act, is that those vaccines covered under Part D should be free going forward. That's something that I could double check on, but I would make sure that they billed all of your insurance, because there was one time I talked to a client who went to CVS, and they just didn't run her insurance correctly, and that's why they charged her copays. So you may want to double check that. Otherwise, we can certainly look into that for more information. Okay, next question. Due to that confusion, my sister and brother-in-law selected. Oh, okay. So this is again related to the idea of those really low cost generic drugs not having the deductible. This individual's sister and brother-in-law selected a much more expensive Part D plan because they were concerned about the deductible. Yeah, that's something important to keep in mind. Okay. So let's see, if you have USC senior care, or you should get 20% off major dental work if you have a USC Gold Card. Thank you, Jeanette, for sharing that. Oh, thank you. There's such nice comments in the chat here. Thank you so much. Another comment here. USC senior care does not cover prescription drugs, so you do have to have a separate Part D plan. Yes, and so that is just going back to this slide here, just as a reminder, and then I know this slide is kind of a mess, but original Medicare, red, white, and blue card, Part D drug plan, and then USC senior care as a secondary coverage. So do keep that in mind. And then Jeanette, there was a question about what is a gold card?
Okay, for USC employees who've worked at the university for 10 years or more in a benefits eligible capacity, and they've served 10 years, they're eligible for rehire, and they're over the age of 55, they can apply for the USC Gold Card. And that provides discounts, parking, email, and other perks. So again, this is for USC employees.
Great. Okay. Well, I've gotten to the end of the questions that were put in the chat box. So I guess if anyone else, has other questions, please type them in very quickly. But other than that, let me go back to our contact information here. And if anyone has questions that come up, obviously for USC senior care, I do recommend you speak to the experts on campus there. I see there's one last question here. Or a couple. Okay, so my wife was informed she has auto enrollment. She doesn't have to enroll. So if she is already receiving benefits through Social Security, then she will get automatically enrolled into Medicare. Once you sign up for retirement benefits, or if she took early retirement, or if she's on SSDI, then benefits will be automatic. You should get the card in the mail. You don't have to submit a separate application. Since most of the folks we talk to these days are continuing to delay their Social Security retirement benefits, or are not even at full retirement age at age 65, that's when you will have to submit an actual application to enroll into Medicare. But it's certainly possible that she will be auto-enrolled. The name of the lawsuit regarding the physical therapy or other skilled care. It's called JIMMO, JIMMO v. Sebelius. So Sebelius, she was the HHS secretary when this lawsuit went through. There is a lot of really helpful information about JIMMO v. Sebelius on the website for the Center for Medicare Advocacy, CMA. The Center for Medicare Advocacy, they were, I think, the lead organization. They're attorneys and other advocates that work on Medicare stuff, I think in Connecticut, New York. But lots of information on their website. There's a whole JIMMO v. Sebelius toolkit. So hopefully that will be helpful. The deductible for Part D this upcoming year is $505. But again, keep in mind that some of the plans, you know, especially the Medicare Advantage plans, will waive that deductible. They won't even have it. And some medications you may be able to access without having to meet your deductible first, but it's $505 for this upcoming year. Okay, next question here. What is the generic name for programs like yours? I want to find the equivalent for New Hampshire for advice about alternatives there. So every state has a program like ours. It might be called the SHIP program, State Health Insurance Assistance Program. I don't know the phone numbers for every individual plan off the top of my head, but you have three options. So one, you can call 1-800-MEDICARE and they can give you the contact information for the agency in New Hampshire. If you've received your Medicare Renew booklet in the mail, I'm looking to see if I have a copy here and I don't, but on the back cover, oh, yeah, Mary Ann's got it. So on the back cover, it says something about needing, you know, do you need local assistance? I feel like you're doing such a lovely job of displaying that. Thank you so much. So on the back cover, it says something about localized assistance or local help. It does mention the HICAP program and gives the statewide number. In New Hampshire, if you received your Medicare Renew book, it should also have the phone number for your local assistance program. And the last option is that you could also go to shiphelp.org. So SHIP as in Peter, HELP.org. And all of the SHIP programs have all of their contact information on that website as well.
Thank you.
Yes, you're welcome. And then the last question that I will take here, it says monthly cost for Part D. It varies from plan to plan. There is no set monthly cost for Part D the way that there is for Part B. So for drug plans, it's going to vary depending on which plan you sign up for. And that is why it's really helpful to compare your options every year, because those premium amounts change every year. I read something recently or last year that said like 80 something or almost 90% of Medicare beneficiaries pick a plan when they first go on Medicare and never, ever change. For some people that makes sense. For other people, it really doesn't, because the costs change so much. You could be paying a lot more for coverage that you could be paying less for. So the monthly cost for Part D varies from plan to plan. I definitely recommend talking with the folks at the pharmacy school if you want to look at your different options. But yeah, it varies quite a bit. So thank you so much. It's been a pleasure to share all this information. Thank you for having me, Jeanette. But I will let everyone get back to their days. So thank you.
Thank you so much, Stephanie. Really appreciate your time and your effort on this and your expertise. So thank you so much. This will be recorded. So if you'd like to forward this to someone else, it will be on our website probably within a week. So we'll have it ready for everyone. So again, thank you all for joining us. And again, thank you, Stephanie. And make sure that you sign up for the Medicare D consultations if you need help with the pharmacy students. They're excellent. And I don't look at the stuff on TV where they have that advertisement that keeps coming up for Medicare Advantage advisors. Use the pharmacy. Don't use those advisors. No, no, no. That's terrible.
Yes, yes, could not agree more. All right.
Okay.
Happy Halloween, everybody. Have a
Happy
great
Halloween.
weekend.
Take
Thank
care.
you.
Bye-bye.